In today's video, we're talking about Vyvanse or Lisdexamfetamine. And so is Vyvanse the Cadillac of all stimulants? Well, yes, it is. In today's video, you're going to find out why. So stay tuned. So what is Vyvanse or Lisdexamfetamine? Well, Lisdexamfetamine is a prodrug of dextroamphetamine or D-amphetamine. And this dextroamphetamine is bound to the amino acid lysine, hence the name Lisdexamfetamine. Now, this binding causes slower absorption as well as longer lasting effects, hence the Cadillac of stimulants. Now, this Lisdexamfetamine is converted back into the active drug, the D-amphetamine, in our gastrointestinal tract once it is absorbed and into our blood or red blood cells. We'll do the metabolism of it, which we'll talk about later on. And so this active drug, the D-amphetamine, is a sympathomimetic drug or a central nervous system stimulant, and therefore it's categorized as a stimulant. And so amphetamines or stimulants as a group are dopamine and norepinephrine inhibitors and releasers in our brain. And when you increase dopamine and norepinephrine in the dorsolateral prefrontal cortex, this specifically will help with attention, concentration, and wakefulness. When you increase dopamine and norepinephrine in the basal ganglia, this can be very helpful for that hyperactivity. When you increase those neurotransmitters in the medial prefrontal cortex and the hypothalamus, this may improve depression, fatigue, and even sleepiness. And so Vyvanse comes in capsules and chewable tablets, and a therapeutic dosage range is anywhere from 30 to 70 milligrams. And so what is Vyvanse used for? Well, Vyvanse was FDA approved in 2007, and it got approved for ADHD or attention deficit hyperactivity disorder in ages 6 and older. Then in 2015, it got approved for moderate to severe binge eating disorder. Now, off-label uses are treatment-resistant depression, and some providers will use it for weight loss. However, there is an FDA warning specifically about using stimulants such as Vyvanse for weight loss. So the use of these type of sympathomimetics for weight loss has been associated with a greater risk of cardiovascular events such as sudden death. Therefore, it's important that you know as the patient that the safety and effectiveness of using Vyvanse and other stimulants for weight loss or treating obesity has not really been established. And so how long does Vyvanse take to work? Well, when you take your Vyvanse, it's going to take 2 hours before you start noticing an effect. And those effects will last anywhere from 10 to 12 hours. However, many patients will say it lasts even longer, up to 16 hours. And this is seen in those therapeutic dosages between 30 and 70 milligrams. And also it's important to note that more effectiveness is noted over time. So usually within 2 to 4 weeks of taking Vyvanse consistently, you're going to gain the most benefit. So hold on if you're just starting it and you took your first dose and you're noticing some effectiveness, but you aren't 100% happy with the effectiveness, because over time that will improve. So is Vyvanse addicting? Well, yes, it is. Unfortunately, it's categorized as a controlled substance and has the potential for drug abuse. It can also lead to tolerance and dependence. However, there is a less potential for abuse than the other stimulants because Vyvanse has that delayed onset of action and does not get broken down to its active form, to that D-amphetamine, until it reaches the gastrointestinal tract and then gets absorbed that way. So because of that, there is less abuse potential with Vyvanse. Now, withdrawal symptoms can occur with Vyvanse, and so it's important if you're taking it for some time that you decrease it slowly to come off, because withdrawal symptoms such as severe fatigue, anxiety, and depression can occur. And so now, what are those side effects of Vyvanse? Well, the most common side effects are the following: increased heart rate, anxiety, feeling jittery, irritable, insomnia, dizziness, decreased appetite, decreased weight, anorexia, dry mouth, diarrhea, nausea, constipation, upper abdominal pain, and vomiting have been reported. Now, less common side effects are the following: somnolence or sedation, ECG or cardiac rhythm changes. Things like ventricular hypertrophy have also been reported, chest pain, palpitations, hypertension or high blood pressure, rash, compulsive talkativeness, tics, tremors, and even anger can be a less common side effect associated with Vyvanse. And now some warnings and precautions with Vyvanse. So Vyvanse, such as other stimulants, can cause vasoconstriction. And this is important when we're talking about placental perfusion and a pregnant woman. Therefore, it's really not advised for a woman who's pregnant to be taking stimulants because it can lead to issues with delivery. Premature birth can be a factor, and these babies will end up having very low birth weight and a lot of complications. So therefore, stimulants are just not advised during pregnancy. So it's important to note that serious cardiovascular reactions or events such as sudden death have been reported with Vyvanse. And the risk is increased with patients who have cardiac abnormalities, cardiomyopathy, serious heart arrhythmias, or coronary artery disease. And so therefore it's important to get an EKG, especially if you're a child, because there could be some structural abnormalities that you are born with and may not come out until you get an EKG. You may not even know it. So make sure that you get an EKG, get monitored by a cardiologist or your pediatrician before starting a stimulant medication, because these events can occur. It's also important to monitor your blood pressure and heart rate, because high blood pressure and increasing heart rate can be a factor. So make sure you're checking that regularly and that you're not getting affected by that side effect. It's also important to note that psychiatric adverse reactions can occur, such as mania and psychosis. And this can happen in the absence of someone having bipolar or schizophrenia or a psychotic disease or illness. And so it's important to be monitored prior to taking a stimulant for those conditions, and also looking at family history, because you're going to be at a greater risk for that if you have a family history. Now, it's not to say that you can't be on a stimulant per se if you have bipolar or schizophrenia and ADHD. What it means is that you need to be stable for quite some time, usually 6 months to a year, before considering adding something like a stimulant. However, some providers will err on the side of safety and reduce risk of harm to their patients and give them a non-stimulant medication to treat those ADHD symptoms if they have comorbid bipolar or schizophrenia or any other psychosis or mental illness of that nature. Now, suppression of growth can also occur, so it's important to monitor height and weight, and this is particularly true for pediatric patients. And then due to that vasoconstriction, those with peripheral vasculopathy or like Raynaud's disease or Raynaud's phenomenon are going to have to be very careful with taking a stimulant, because it can make that symptomology a lot worse, where you can have a lot of constriction to your extremities, and that can be very painful. So you may not be able to tolerate Vyvanse or other stimulants. It's also important to note that serotonin syndrome can occur when you take stimulants along with antidepressants. So make sure that you're being monitored very closely for serotonin syndrome. And so now let's get into those drug interactions. Well, remember I mentioned that Lisdexamfetamine is converted to the active drug D-amphetamine in the gastrointestinal tract once it's absorbed. Then it's actually metabolized by those red blood cells and then excreted through the urine via the kidneys. However, even though there isn't any metabolism via the CYP enzymatic pathway or via the liver, Vyvanse has been shown to be affected by the CYP2D6 inhibitors. And so here's a list of some common inhibitors that you may run into. But it's important to do your drug interaction checks, and I'll make sure to put the link to a drug interaction checker for you down in the description to make sure that you're always checking for drug interactions of your medications and discussing those with your provider. And with Vyvanse, you also want to avoid the use of acidifying agents. And acidifying agents are things like citric acid, like in orange juice, or some food additives or other citric juices. And the reason why is because when you are acidic, you actually will decrease the effectiveness of Vyvanse. Now, the opposite can also be true, where if you're taking alkalizing substances like things high in baking soda or sodium bicarbonate, that can actually increase the dextroamphetamine in the blood, which can lead to side effects like cardiovascular events and hypertension and rapid heart rate. So be careful there. And that's why it's better to take Vyvanse on an empty stomach with a glass of water. When you first wake up, then do your activities for the day. A couple hours later, then you can go ahead and eat your breakfast, take your orange juice, etc. Because at that point, it won't be affected. You also want to be careful with the tricyclic antidepressants, because not only will they risk the serotonin syndrome, but taking combination of Vyvanse with tricyclic antidepressants can actually increase those cardiovascular side effects like high blood pressure and irregular heart rhythm. And you want to make sure to stop taking an MAOI inhibitor at least 14 days before starting Vyvanse, because there's an increased risk of hypertensive crisis. And so what are my final thoughts on Vyvanse? Well, Vyvanse is known as the Cadillac of all stimulants. And if you didn't catch it already and you haven't figured it out, it's called the Cadillac of all stimulants because of the way that it's absorbed in the gastrointestinal tract and the way that it's slowly released in the blood. And so that slow release allows for a smoother ride of your stimulant instead of the roller coaster effect that often happens when taking other stimulants. So that's why it is called the Cadillac. It's also better tolerated than those other stimulants for that same reason. However, you still want to monitor and look out for those side effects and weigh out risk versus benefit of taking this medication, and leverage skills before pills when it comes to using medication for ADHD, because there still is that potential for side effects, cardiovascular events, and even drug abuse and withdrawal effects. And so there you have it. That's my overview on Vyvanse. Do you have experience taking Vyvanse and want to share it with us? Go ahead and drop your comment down in the comment section below, because we learn from sharing each other's experiences. And as always, I thank you all for watching, wish you well on your mental health care journey, and I look forward to seeing you all next week.